The goal of swallowing is to move food and liquid from your mouth to your stomach. Normal swallowing involves coordinated movements of many small structures in the mouth and neck. Let's look at a normal swallow seen with video X-ray, also known as a modified barium swallow study. There are two primary goals of swallowing. One is don't leave anything behind to prevent residue after the swallow, and two, keep the breathing tube clear to prevent aspiration. But how does this happen in a normal swallow? Normal swallows often don't leave anything behind because the tongue and throat muscles, also known as the pharynx, squeeze food and liquid back and down into the esophagus. What happens when food and liquid are left behind in an abnormal swallow? This is an individual with a swallowing problem trying to swallow 1 teaspoon of pudding. As you can see, food is left behind even after multiple swallow attempts. Typically, in a normal swallow, 1, maybe 2 swallows would be sufficient to completely move all of the pudding into the esophagus. How does a normal swallow keep the breathing tube clear? In addition to other structures, the voice box, also known as the larynx, closes to keep food or liquid from entering the windpipe, also known as the trachea. What happens when food or liquid goes into the windpipe? This is an individual who's swallowing thin liquid that enters the windpipe. Although normal swallowing can sometimes leave residue behind or have food or liquid enter the trachea, generally it's rare. But the good news is that normal swallowing is automatic, so you don't have to think about how to make it work properly. Normal swallowing requires movement of many parts of the mouth and the throat. Normal swallowing involves pushing food cleanly down without getting into the windpipe. And normal swallowing is automatic.